Leaky gut syndrome, or intestinal permeability, is a chronic medical condition that has been part of traditional medicine since before 1929. Over the years, there have been hundreds of publications in the Western medical literature describing this medical condition and its importance. This is not a disease. It is the result of lifestyle, medications, and diet. And fortunately, the diagnosis of leaky gut syndrome is made by a simple urine test. This is a short list of symptoms that are associated with leaky gut syndrome, including abdominal pain, insomnia, bloating, food allergies, constipation and/or diarrhea, liver dysfunction, changes in memory and cognition, constant hunger pains, depression, chronic fatigue, multiple chemical sensitivities, migraines, and recurrent vaginal infections. A number of chronic medical conditions are also associated with leaky gut syndrome, including fibromyalgia, chronic fatigue, irritable bowel, ulcerative colitis, chronic hepatitis, psoriasis, inflammatory bowel disease, ankylosing spondylitis, and even heart disease and a number of cancers can be associated with the results of leaky gut syndrome. There is compelling but not absolute evidence that it also may play a role in autism, ADD, and ADHD. Leaky gut syndrome is the result of the effects of a number of different factors, including medications such as antibiotics and painkillers, steroids, and chemotherapy, as well as stress, lack of exercise, and a number of factors involved in diet, including starchy foods, dairy products, sugars, and even unfiltered tap water. In the normal bowel, the intestinal wall cells are very tightly joined, and these are very tight intracellular connections. They are also covered by a slime layer that contains good bacteria known as the biofilm. Substances are absorbed through these cells and are processed in a very extensive group of immune cells called Peyer's patches before being sent off to the rest of the body. Nutrients are absorbed through the cells of the intestines and are processed in the Peyer's patches initially. They are then sent to the liver for further processing and then are made available to the rest of the body. Toxins, however, generally are unable to cross the cell wall and are excreted in the bowel movement. With leaky gut syndrome, however, the tight connections between cells can break down. This results in toxins being able to directly enter the body and are processed in the Peyer's patches. With an overflow of toxins into the Peyer's patches, this can dramatically affect how the immune system works, resulting in allergies as well as the possibility of autoimmune conditions. These toxins can then spill over into the liver and actually overwhelm the liver's ability to detoxify, resulting in toxins being sent out to the various parts of the body, including the nervous system, the cardiovascular system, and the endocrine system, all resulting in a myriad of confusing symptoms. Fortunately, the test for leaky gut syndrome is a simple urine test that involves measuring how well sugars will cross the intestinal wall. Treatment is individualized, involving several supplements, a number of lifestyle changes, some dietary modifications, as well as the possibility of changes in medication, all designed to accelerate the healing of the intestines and the return to normal function.